afternoon. So today we are going to do a demonstration on the intramuscular injection. So for that, first we have to see about the articles which is needed for the intramuscular injection. So first one, we need a cutlery which is containing with a pair of gloves, and then the spirit which is needed in order to clean the area of injection, and then a cotton swab we need in order to clean the area before the injection as well, and then a kidney tray, the medication, and the syringe and needles. So these are the articles which is needed for the injection. So next is we have to start with the procedure. Okay, so the procedure for the intramuscular injection is, first before starting with the procedure we have to explain the procedure to the patient, that what are all the things that we have to do for the patient. So after explaining the procedure to the patient, we have to select the site of injection. So the sites of injection we are doing for four sites of intramuscular injection. So the first site, the most preferred site is the deltoid muscles, which is present on the arm, that is from the olecranon process till the from the acromion to the olecranon process. This is the part which is called as the deltoid muscle, and then the next one is the vastus lateralis, which is present or which is located on the thigh region, and then the third one is the dorsogluteal muscles, and the fourth one is the uh, ventrogluteal muscle. So these are the four sites which is used for the intramuscular injection. So the most preferred site is the deltoid muscle. So today we are going to discuss, or we are going to do on the injection of the IM on the deltoid muscle. So before starting the injection, before we are cleaning, so we have to clean the area of injection in a circular motion. Suppose if we are cleaning the injection over the area in this area, so we have to start we have to clean it in a circular motion, that is from inside to outside the area of injection, and then the cotton swab which we are using for cleaning we have to store in the kidney tray, and then we have to allow the skin to dry. So why we are allowing the skin to dry is it will help us, or it will help the patient, or it will prevent from any kind of skin irritation. So once the skin is dry, so you have to start the injection and then check if there is any bubbles which is present in the syringe. If there is any bubbles which is present in the syringe, we have to remove the bubbles, and then we can uh, insert the needle. So once you start this intramuscular injection, actually we have to keep into a 90-degree of angle, and then when before you are giving the injection, we have to punch the area so that it will help to reduce the pain when you are inserting the needles into the patient's muscle. So we have to hold the syringe in a form of like the straight, with our, like how we are holding a pen or pencil. In that way we have to hold the syringe, and then we have to insert it into a 90-degree angle. So once you are inserted, so we have to, once it is inserted, we should first how to check that if it is the needles, it is really into the muscles or not. So in that we have to check if we have to withdraw the plunger, if there is any air bubbles is coming or not. If there is air bubbles which is present in coming into the syringe, that means it is indicated that the medication or the injection it is into the muscle. So in that case we can insert, or we can push the medication into the muscle. And suppose if there is no air bubbles coming, or instead when you are removing or withdrawing the needles, the plunger from the muscles, in case if there is any blood is coming, so in that we have to remove the needles immediately. So once we are done, once it is injected, or when the medication is pushed inside, so slowly we have to remove the needles, and then we have to keep the dry cotton over the injection area. And after that, after the injection, we have to observe the patient, and the syringe and the needles we have to remove it, or we have to discard it into the particular uh, bin, or into the particular box or the container which is supposed to discard. Start. The last step of the procedure is very important point, that is we have to do the documentation after the procedure. So the documentation that is related what are the indication, which is the medication that is given for the patient, and then what are the which site that we have inserted or injected the medication. It can be the dental muscle or it can be into the dorsolateral or ventrocrucial. And after that, after the documentation, so we have to replace all the articles, and then apart from that, we have to observe the patient if there is any pain which is present over the area which is injected. So that is about the intramuscular injection. Thank you.